Mitral stenosis, valvular heart disease in which there is a narrowing of orifice of mitral valve due to structural abnormality of mitral valve. The etiology includes rheumatic fever, it may be congenital, there may be calcification of the mitral valve in elderly, SLE, and gout. Now let's see what happens if there is stenotic mitral valve. There will be increase in left atrial pressure. So when there is increase in left atrial pressure, LA pressure is increased, the, the mitral valve is stenosed, blood can't flow out properly, and this causes left atrial enlargement. So LA, as you can see, has enlarged, because of which it compresses esophagus, which causes dysphagia, and the lower lobe collapse or consolidation occurs, which is EVARD sign. Because of this, there will be atrial fibrillation. The left atrium increases, enlarges. There will be there will be atrial fibrillation, because of which there will be stasis of blood, decreased ventricular filling, palpitation, thromboembolism, which further causes stroke and peripheral emboli. After which we get pulmonary congestion. This is due to reduced blood flow back from the lungs to the heart, especially to the left atrium. Post pulmonary congestion, we get pulmonary edema. Due to pulmonary edema, there will be dilatation of pulmonary artery. So there will be dilatation of pulmonary artery, compression of left recurrent laryngeal nerve, because of which we get hoarseness of voice. And we also get pulmonary hypertension. There will be high pressure, which ruptures the pulmonary vessels, which further causes hemoptysis. There is increase in RV pressure now. So increase RV pressure. This causes RV hypertrophy, and RV pressure increases, which further causes right ventricular failure, which further causes functional tricuspid regurgitation. There will be decreased cardiac output, because of which we get fatigue and dyspnea. As you can see, we have reached up to right ventricular hypertrophy, and we also get dyspnea due to pulmonary edema. So this is what happens roughly in a mitral stenosis. Clinical features of mitral stenosis. It includes, as we have seen, dyspnea on exertion, fatigue on exertion, then hemoptysis, syncope, hoarseness of voice, orthopnea and PND. Orthopnea and PND. Uh, then we have mitral faces, that is, the face appears something like this. That is, there will be cyanotic lip and face cyanotic lip. As you can see, bluish discoloration of face and the lips. Mild jaundice, as I have colored it here with yellow. Then dusky pink discolorization of upper cheek. As you can see, this is dusky pink discolorization of upper cheek. There will be increased jugular venous pressure, heart sound. Upon placing stethoscope on mitral listening point on the apex of the left ventricle, we get at the left mid-clavicular line, 5th intercostal space, we can clearly hear loud S1 and S2. S2 and S1 will be of loud intensity. There will be mitral opening snap, as I have mentioned here. There will be mitral opening snap, after which we get mid-diastolic and pre-systolic murmur. The radiological features includes double atrial shadow, straightening of left heart border. Complication: atrial fibrillation occurs, thrombus formation, pulmonary hypertension, pulmonary edema, pulmonary infarction, pulmonary hemosiderosis. Then we also get systemic embolization, infective endocarditis, hemoptysis, dysphagia, lower lobe pneumonia, right heart failure. Treatment of mitral stenosis. Primarily treat rheumatic fever using rheumatic fever prophylaxis. Then decrease the sodium intake. Anticoagulants are given. Diuretic is given for dyspnea. Digoxin for atrial fibrillation. Then we give beta blocker, calcium channel blocker to decrease the heart rate. Surgically, Remember it as mitral valvotomy. The valvotomy is includes balloon mitral valvotomy, closed mitral valvotomy, open mitral valvotomy. Then we finally do a mitral valve replacement. The indications includes mitral stenosis associated with mitral regurgitation, severe damage, severe calcified stenotic valve. As you can see, when there is very severe damage and calcification of the stenotic valve, which cannot be opened without producing regurgitation, we do MVR. Then moderate to severe mitral stenosis plus include along with thrombus in left atrium even after anticoagulation is given. So MVR is the indication. So to summarize it up, definition: narrowing of mitral valve due to structural abnormality of mitral valve, etiology, some 3-4 etiology, and how what happens, the pathogenesis in mitral stenosis, wherein there is increased airway pressure, left atrial enlargement, pulmonary congestion, pulmonary edema, which causes further symptoms. There will be atrial fibrillation due to left atrial enlargement. Then we have to remember clinical for 2-3 clinical features: mitral phases, as you can see in the diagram, heart sound, what happens, it has opening snap, diastolic, presystolic. Then radiological finding, complication, treatment, medical treatment, surgical treatment, and finally indications of mitral valve replacement.